Hello, my name is Zach Evans. I'm a VA disability attorney with Woods & Woods Attorneys in Evansville, Indiana. Today we're here to talk about VA disability ratings for knee injuries and knee pain. The relevant CFR section is going to be 38 CFR section 4.71a, and that's going to cover your skeletal conditions, muscular conditions, things like that, so physical ailments. So I think in order to properly discuss how knee and leg conditions are rated, we want to go through some terms essentially. So the way that your knee conditions are rated primarily is based on your range of motion and something called functional loss. One of the first diagnostic code numbers is 5256. And that's for ankylosis of the knee. Ankylosis is defined as an abnormal stiffening and immobility due to a fusion of the bones. So usually we've got some issue with the cartilage there, and we have a major knee injury and the bones are starting to grow together. It's part of the healing process whenever you have an injury to a joint like that, but over time it can result in a major functional loss because it stiffens to the point where you can't really move the knee with its full range of motion. And so the way that they're going to do the range of motion testing is going to be through a measurement of flexion and extension. So flexion is a measurement that's taken when you bend your knee. Think of bringing your heel up to your butt whenever you're taking a step forward. That is flexion. So your normal flexion reading should be about 135 degrees to 140 degrees. That's a normal healthy knee. Then extension is going to be the other measurement that they'll take in a C&P exam where they're trying to, compensation and pension exam where they're trying to evaluate the loss of range of motion in your knee. So extension is how flat you can straighten your leg. Normal extension reading is usually between 0 degrees and -10 degrees. So a slight amount of hyperextension in the knee joint is actually perfectly normal. Then another term that we want to cover is subluxation. So subluxation is a partial dislocation of the knee. It's defined differently for different joints, but with your knees you're usually talking about the patella or the kneecap. So the patella is held in place by a system of muscles and ligaments. And if this is injured, it can cause the patella to slide out of place. Often whenever we see this, instead of riding the groove at the bottom of your femur, whenever you bend the knee, it rides that groove up and down. Whenever you have an injury to this ring of musculature and ligaments around that joint, you'll see the kneecap slide to the outside. And that's just because you have a laxity in the structures that really hold that knee in place. The next type of phenomenon that we can see with a knee that's experiencing some disability is effusion. So anyone that has had a twisted or a sore knee knows that it can fill up with fluid, it swells, and can really affect your range of motion. We see effusion happen during what are known as flare-up events. So let's say you have an injury to your cartilage in your knee, what's known as your meniscus. Whenever you have a flare-up event, let's say you slightly twist or you step down some stairs just a little bit incorrectly, or you have like an awkward landing when you're coming down a flight of stairs, you can aggravate that old injury, that old soft tissue injury, and it can cause inflammation in the knee. And as a reaction, your body's reaction to that sometimes is to fill the knee up with fluid as a protective mechanism. Unfortunately, you lose some range of motion when that happens. C&P exams are supposed to provide an opinion as to loss of functionality during these flare-up events. Oftentimes, however, whenever we review these compensation and pension exams, the examiner has glossed over the issue of flare-ups. And even if they're not testing you during a flare-up, we often see no indications of them asking the question in a clinical setting. So oftentimes whenever we're reviewing knee exams, that's one of the things that the examiner misses that they're supposed to cover. And we see a lot of problems of that type. Another rare condition or rare phenomenon of the knee is called genu recurvatum. It can have some congenital genetic sources in terms of why that occurs, but essentially it is where the knee actually hyperextends dramatically and bends backwards. It can also be caused by some very severe ligament and tendon laxity after an injury, but that's a little bit rarer type of a knee problem. So one of the things that I want to leave you with here today is whenever you're in a C&P exam and they're looking at your knee and they're looking for indications of changes in your range of motion, because all of these different types of knee injuries or knee phenomena are rated to give you a disability rating based on your extension limited to X number of degrees. So for example, if you can only extend your knee out to 30 degrees, then that is a 40% rating. If your extension is limited to 45 degrees, that's a 50% rating. So I'll let you check that out in 38 CFR section 4.71a. There's an entire listing of all of these different criteria for your knee limitations. But whenever you're in a C&P exam, they're measuring these limitations, they are measuring your functional loss. Pain is an element of functional loss. So I know it's really easy to show up and they ask you these seemingly innocuous questions of, how are you doing today? Are you feeling okay? And knees bothering you? Are they all right? And maybe you just respond almost automatically. Yeah, my knees are okay, or not so bad today, or something. And then you get into the testing and you're experiencing some pain as your knee is being extended outward due to that old knee injury. Say something. Do not tough it out and remain silent during your knee examination, because you will pay for it on your rating. Functional loss occurs whenever your pain onset begins. So if you experience pain at 20 degrees extension, you need to say something to your examiner. Don't tough it out. Don't try to continue to move through and silently struggle through this examination, because that pain onset is a component of your functional loss and will directly impact the rating that is assigned following your C&P examination. If you have any additional questions about your knee injuries and knee pain ratings for VA compensation purposes, give us a call or go online at Woods Lawyers. We'd love to help.